Good morning. I am Adeline Levinshaw, lecturer of Human as a group of institution. Today topic is diuretics. First we see about the introduction of diuretics. Kidney remove waste product from the blood and produce urine. Kidney control levels of substance in the blood and kidney helps to control the blood pressure. First, we see about the definitions of diuretics. Diuretics is defined as drugs that increase the rate of urine formations. Another, we see the primary action of most diuretics is the direct inhibition of sodium reabsorption to produce increased excretion and urine output is called diuretics. An increased sodium excretion is accompanied by anion like Cl minus since sodium chloride is the major determinant of the extracellular fluid volume. Next, diuretics result is decrease the body fluids like extracellular fluids like sodium, potassium, chlorine, etc. Four major sites of nephron that are responsible for reabsorptions are: first one is proximal convoluted tubule, second one ascending loop of Henle, third one distal convoluted tubule, fourth one collecting duct. Next topic is the function of diuretics. First function is used to prevent the edema and ascites. Ascites means build of fluid in space between lining of abdomen and the abdominal organs. Second uses, it is used to hypertension and diabetes insipidus. Third one, acute renal failure. It is used. Fourth one, it is used for the pulmonary edema and nephritic syndrome, glaucoma. Glaucoma means increase the IOP level. IOP means intraocular pressure. Last one of the function is high intracranial pressure. Another topic is classification of diuretics. These are classified into five. First one is carbonic anhydrase inhibitors. The drugs examples of drugs are acetozolamide, methozolamide, diclofenamide. Second one is thiazides. Thiazides classified drugs are chlorothiazides, hydrochlorothiazides, hydrofluorothiazides, cyclothiazides. The third one category is loop diuretics. Loop diuretics drugs are furosemide, bumetamide, ethacrynic acid. Fourth one is potassium sparing diuretics. The drugs are spironolactone, triambitarine, amiloride. Like the last classification of diuretics is osmotic diuretics. Examples of drug are mannitol. First category of the classification of diuretics is osmotic diuretics. Define osmotic diuretics means inhibit water reabsorption in the proximal convoluted tubule and the loop of Henle and collecting duct where membrane is most permeable to water. Osmotic diuretics means inhibit the water reabsorption in the proximal convoluted tubule, loop of Henle and the collecting duct. For example, osmotic diuretics main example is mannitol. Mannitol helps to osmotic diuretics. The uses of the osmotic diuretics drugs mannitol are: first one is cerebral edema management of cerebral edema. Second uses is kidney function, diagnostic agents for kidney functions. Third one, increase urine volume in patients with acute renal failure. Acute renal patients to increase the urine output. Another one is the structure of mannitol is like that glucose. Next one, the sulfonamide derivatives drug. The sulfonamide derivative drugs are furosemide, bumetanide. The two drugs are sulfonamide category drugs. These two drugs are two series of 5 sulfonamyl benzoic acid derivatives that differ in the nature of functional group that can be substituted at 2 and 3 position. First one is the 5-sulfonamyl 2-aminobenzoic acid, for example furosemide. Second one, 5-sulfonamyl 3-aminobenzoic acid, bumetanide. The SAR of the sulfonamide category drugs. First one is the substitute at the first position must be acidic. The carboxylic group provides optimal diuretic activity, but other groups such as terrazole import good activity. Second one, the sulfonamide group at the position 5 is essential for optical diuretic activity. The third one, at the group at the fourth positions can be chlorine or CF3 as in the thiazide diuretics. Better activity are observed when these groups have been replaced by phenoxy, alkaloxy, aniline and benzyl moieties. The last one, in the case of 5-sulfonamide 3-aminobenzoic acid, the 3-aminobenzoic group can be widely substituted without much change in the activity. Next one, the side 4 diuretics, potassium spalin diuretics. Potassium spalin diuretics in this hypokalemia is caused. Hypokalemia means increase the renal secretion rate of potassium is called the hypokalemia. Three chemically distinct diuretics have emerged that increase sodium and chlorine excretion without concomitant increase in the urine excretion rate of potassium. These agents are known as the potassium sparing drugs. The potassium sparing drugs are divided into two groups on the basis of mechanism of action. First one is sodium channel inhibitors. Drugs are triamiterene and amiloride. Second one, aldosterone antagonists. Aldosterone examples are spironolactone. Aldosterone antagonist means this, for example, aldosterone antagonist drugs are spironolactone and amiterene. The spironolactone is the steroidal derivatives. It is related to progesterone. Mechanisms of aldosterone antagonists. The aldosterones are binding to their receptors, enhance the sodium and the potassium passage in a luminal fluid. The spironolactone comparatively inhibit binding the aldosterone to these its receptors and abolishes its biological effect. These are the mechanism, function and classifications of diuretics. Thanks for watching.